Alright, well, it's been a little over 2 weeks since seeing Dr. Fullerton to treat the tear in my trap, and this is how my hip, and this is how my hip and trap are feeling. They're still sore, it still hurts some, but definitely feel like things are better and they feel more correct. It's a little weird, a little hard to describe. For the first week, everything felt really normal, like I didn't want to try to crack my neck or anything like that. Then the second week, I suddenly started to feel more pains, I guess. I guess as the inflammation died down, things started to revert back to the way it used to be, and now things feel like they're starting to get a little bit better. Second week, I also cracked my neck like once or twice, just like not even thinking about it, just reflexively. But 2 times over 1 week is a lot less than what I was doing before, which was multiple times throughout the day. I still have to be pretty inactive. I'm doing the treadmill, but anytime I try to hold something that's like 2 pounds or more with my right hand, or with my left hand, it doesn't feel good. It doesn't just like hurt, but it doesn't feel good. I try not to raise my arm over my head at all. So basically I'm babying it. And this is really along the same, this experience is about the same timeline that all the other PRP treatments that I've had follow. So it seems like everything's on track. For the hip, he found damage with my glute medius, which I thought was really weird because a lot of the pain is in my groin. But basically what he said, if I understand him correctly, the glute medius puts traction on the hip capsule, and that traction allows the groin muscles to clear the hip joint. So it wasn't working correctly, so it was pinching or hurting the groin. I have my doubts, but when he, I think it nerve blocked it, like he injected the glute med with some numbing agent, then suddenly I could stretch my groin, the groin on that side. I could stretch it like I could stretch the groin on the normal side. So time will tell, but this, it's hard for me to wrap my mind around, but doctor seems to know what he's doing so far, so I'm gonna stick with it. A little over a week out after my treatment, I saw my physical therapist who does dry needling, had him address, like my chest and also my trap, obviously. He could tell something had happened, like there was an increased muscle tone, like tightness in spinal erectors and stuff. He also found issues with my other trap to address all that. This week I'm going to try a different approach, more like a massage. There's a chiropractor that I know that does like really deep tissue type massage, and hoping that I'll be able to get that done this week. I'll report on how that works. But yeah, it's 2.5 weeks out, and really want this to be the final piece of the puzzle so badly. So badly. Anyway, I'll check in later. That is Adam, signing off. Alright, here we go. The ball. Here we go. There was a crack. I don't know if you heard that, but yeah, it's not gonna crack though, so pretty good. I'd say that's progress. Ooh, some knots, but not is different. It's the only way I can describe it, sorry.